Hey, welcome to the Go-To Physio Sports Massage series. Now, what we're going to do today is we're going to cover the lateral thigh sports soft tissue techniques. This is a really good technique that I use for a lot of people with knee pain, but you can also use it for a lot of people with back pain. When you pop them on the front, you pull their heel to their bum and they get quite a stiff back. This is something also. Anyone also that's had previous hamstring injuries, make sure you have a look at this between the vastus lateralis and the hamstring. As always, make sure respect the 80-20 rule with sports massage. This is just treating the symptoms. We need to make sure we get the graded exposure program in order to get lasting results. If you want more information on that, head over to go2physio.com. I've got loads of information there for you. Okay, with that said, hope you enjoy my favorite techniques for the lateral thigh soft tissue mobilization. Okay, so for the lateral thigh, we need to understand that the vastus lateralis actually comes right down here, okay? So it's almost posterior thigh here. So the vastus lateralis, which could be contributing towards this knee pain experience, actually goes right on the lateral thigh, but also the posterior thigh, okay? Obviously, you've got your iliotibial band coming through here. Now, we're not going to be able to, change that iliotibial band. I think it's, it's got the same properties as steel, basically. So my elbow and forearm isn't going to physically change anything got to do with the iliotibial band, but what it can change is all that tissue and that protective tone maybe around it, or especially at the intersections between that hamstring and that vastus lateralis. Okay, so if the nervous system is carrying some protective tone here, that's maybe stopping the joint range of movement or producing a torque in a particular direction, or that muscle to produce force in a particular direction, then maybe we can change that with some of our hands-on work. Okay, so what we're going to do is I like to put the athlete on their side and put a bolster between their knees. Okay, so what I can do then is quite nicely is I'm just going to lower the bed slightly, is I've got this tissue then, okay, and it's much more accessible for me. Okay, so what I will do is I'll get into my squat position, I'll put one hand here, and then I'm in a very strong position here again. So I'm just going to go through that tissue again then quite easily with my hand. Okay, so I'll apply my lotion, etc., and I will go through it. Now I use the iliotibial band as a mark, so I want to go to the front of that, especially this vastus lateralis here, and bring about some kind of modulation here. Okay, and usually you'll get a lot of tightness there. And then what I'll do then is I'll just go to the back of the iliotibial band and I'll work it here. Okay, so all this tissue that I'm working here is actually the vastus lateralis. Okay, so the vastus lateralis is going to come to pretty much here. Okay, so all that tissue, okay, is vastus lateralis. So this tissue here needs to lengthen as Pete flexes his knee. Okay, so again, if we identify that Pete had decreased knee flexion, then we're trying to bring about some modulation here. I would just go through this tissue here, and again I would get the person maybe doing some nasal breathing, etc., so that I know that they're not in a fight or flight response. Again, we can check the pressure. Is the pressure okay, Pete? If he's wincing and he's really tight, I would back off, but for the majority I'm just sinking in and I'm just going up to that tissue. And again, I'm just working up to that greater trochanter. Okay, so this is your lateral thigh. Again, keep it simple, but the key thing here is that you have to understand that the vastus lateralis is here. So working this tissue here is going to improve, hopefully, his ability to flex the knee. Okay, so although it looks like it's shortening here, it's actually his vastus lateralis. Okay, so it's not his hamstring. A lot of people will think that's your hamstring, but the actual vastus lateralis comes right round to the back here. Okay, so the hamstring's actually here, vastus lateralis, that's all that good tissue there that we may want to bring about a change. Okay, so that's your lateral thigh. Again, especially anyone with knee pain, it may be worth investigating here. Is there any protective tone here? And that's an area where we might use our hands to decrease that protective tone. Hey, so I hope you found that technique useful. As always, please respect the 80-20 rule and understand that we're just treating symptoms here. We haven't found the true cause. If you're interested in learning more about how to find the true cause, head over to www.thegotophysio.com. I've got plenty of tips there for you and loads of content to help you become that go-to therapist that helps people who have failed traditional approaches. See you next time.